Have you ever been told that hormone therapy protects your bones, but no one explained how or when it even actually works? Or maybe you've heard the opposite, that hormones are risky and should only be used as a last resort. And if that sounds familiar, then this episode is for you. This is episode 4 of our 5-part bone health series. Now, we had other episodes, and I strongly recommend you start at number 1, episode 1. We talked about screening and the interpretation of these screenings and bone health and why we need to be concerned. It's such an important part to listen to first. Then we did episode 2, and that was about movement and how bones respond to load and what exercises we should be doing. And then episode 3 was about feeding our bones and the nutrients that they need. And today we're going to cover the hormonal pillar. And then the last episode is going to cover sleep and stress, because bone health is mechanical, it's nutritional, and it's hormonal. And I put this information together for you based on what I've learned as a gerontologist. I've had so many interviews with bone experts such as Dr. Doug Lucas and Dr. Vonda Wright. Dr. Jocelyn Whitstein is coming on, but I've just read her book, Dr. John Newstead, as well as many of the other functional medicine doctors who I've interviewed on the podcast. And I've done my own research, loads of books that I've read on bones, websites I dive into, other podcasts, and online rabbit holes. So that's where this information comes from. Anything I say in this podcast may or may not be relevant to you. I don't know. The science continues to evolve, and I continue to learn, and things can change. So take what I say in any of my guests, when any other thing that you listen to and read, take it all with a grain of salt. Talk to your doctor about implementing some of the things that you're hearing. This episode is for informational purposes only. I don't know your own personal health history, so bring your questions to your own health provider who can really guide you and give you a personalized approach. And if you haven't already, please subscribe to the podcast. Turn on the notifications so you don't miss the remaining episode, or go back and listen to the early ones if you need that foundation. And also in the show notes, I have the free mini bone guide. And it's really practical, and it's a really great place to start when you're totally kind of overwhelmed and not sure where to go. It's a mini bone guide. It's very simple, but it's just to get you started. And if you want deeper support, then join us inside the Biohacking Menopause membership group. This is a women's only private membership support group for women going through menopause. And we implement all the things that we talk about in this series together. And today, let's get into the hormone therapy and bones. So there's a shift, obviously, when we go through menopause. And we usually talk about estrogen. Usually it's estradiol, because there's different types of estrogen. And we talk about progesterone and testosterone. But mainly when it comes to bones, we're most often talking about estrogen, estradiol. So estrogen plays several roles in our bone health. It suppresses osteoclast activity. That means that bone breakdown. It stops that from happening, right? It's really important for that. It supports osteoblast function. That means it helps with the formation of bones and building, because bones are living tissue. There's this active breakdown and buildup at the same time. It's beautiful. It's amazing how the body works. But when we lose our estrogen, then we're actually breaking down bone faster than we're actually building it up. And that's the problem. And when we bring estrogen into the picture again, or at least when we have it when we're young, it maintains that beautiful balance that we need. And these effects really occur directly on the bone. And estrogen is also an anti-inflammatory. I'm sure you've heard of this. It's like your natural anti-inflammatory. You don't need any supplements for this. It's great. And usually we're using this in the context of joints and how that supports the joints. And we're not going to talk about the joints today, and this whole series doesn't even talk about. I should probably do a whole other series on joints, because no one knows joints and feels it more than I did, living with osteoarthritis for years, and now 2 hip replacements later. Boy, I miss my estrogen. So when estrogen declines in menopause, let's reel it back in, let's pull it back. When it declines, that bone resorption accelerates. Remember, that's accelerated bone loss. Bone formation can't keep up, and then we're just losing bone. Now, one thing that's really important to know is that when we're going through perimenopause, bone loss is accelerating, and it peaks in the first 5 years post-menopause. And that means during those menopause, and just a little recap, 12 consecutive months without your period. You cannot believe how many women don't know this. So this is why I repeat this over and over again. And don't feel bad if you're one of those, because you're not alone. A lot of women still don't know what perimenopause is and what is menopause or postmenopause. And so bone loss is really accelerated during this period, and it has about 10 to 20% of the bone loss is happening. This decline is happening during this period. And it's usually most of the lifetime loss is in this post-menopause phase as well. So yeah, it's perimenopause is not only hard on us on the outside and the things that we feel, but on the inside as well. And the total loss over the first 5 to 10 years post-menopause represents roughly half of the lifetime bone decline. So this is why timing of hormone therapy, if you're going to do it, is really important. Now, what does the research show? There's so much research out there. There's thousands of studies. And I've jumped onto PubMed. It's just one of the platforms to look at. And if you if you put in the search, hormone therapy, bone health, menopause, postmenopause, you're going to find thousands of them. I found 1,917. Okay, and there's hundreds of randomized controlled trials, which are the gold standard of studies, and over 20 meta-analyses. These are meta-analyses are studies that look at other studies, like they pull them all together, and they all show benefits. They all show that hormone therapy consistently reduces bone loss, maintains bone density, and lowers the fracture risk, because that's what I care about. Am I going to fracture or not? Like, I don't care about a number. I just want to know if I'm likely to have a fracture. And if I do, am I going to recover quickly? That's important to me. So loads of studies are showing, most of them are showing there's improved bone mineral density, okay, and lower fracture risk with consistent positive effects. This is why menopausal societies around the world agree that hormone therapy is great for your bones. It's a preventative measure. Now, I'm going to share some more studies here. And I pulled these out from Dr. Mary Claire Haver. She's an OBGYN, or obstetrician gynecologist, somebody who deals with babies and deliveries, as well as women's health and gynecology. And she had a great Substack article, which I will link in the show notes as well, about bones and HRT. And she highlighted a few key studies, and I'm going to pull some of these out. There was the study of osteoporotic fractures, and this was a research by Ettinger and his team published in the Journal of Clinical Endocrinology and Metabolism. And they found out that postmenopausal women with blood levels, serum levels of estradiol below 5 picograms per ml, which is seriously postmenopausal, like that's very low, they had much lower bone mineral density and a higher risk of fractures, which is what we want to know, compared to women with higher levels. Okay, it'd be interesting to know how high were they talking about. That finding has been replicated over and over and over again over the past 2 decades. This is nothing new. And then there was another study that she pulled out this was by Bagger and colleagues from 2004, so it's a 20-year-old study, but they found out that even just a little higher levels of estradiol above 10 picograms per ml. Like, we're talking about if you were to take a blood draw and try to find out what your estradiol levels are, they're saying 10 picograms per ml were associated with 6 to 14% higher bone mineral density in young postmenopausal women. That means women who are just within several years of their birth date, 12 consecutive months without their period. And so they had 6 to 14% higher bone density compared to those with lower levels. And that could be the difference between a bone that's strong and holds up and another bone that actually fractures, and that reduces quality of life and causes a lot of other problems. So we don't really want to go there. And then there's another study that shifted how she thinks about target levels. Jamka and colleagues, 2021, they looked at biochemical bone turnover markers in postmenopausal women and found out that only women with estradiol levels at or above 25 picograms per ml had balanced bone formation and resorption markers, meaning that the bones were breaking down and building up at the same time. They were in balance. And below that threshold, resorption outpaced formation. So that was bone being broken down faster than it was actually being built. And even if the woman felt fine, like that's kind of what Dr. Doug Lucas and Dr. John Newstead, who are both bone experts. And I had them on the podcast. I'll have a link to that in the episode and in the show notes as well, because that was a brilliant episode. And I had them on together, and it was a round table. And they also talked about the research that they've been looking at. And Dr. John was saying that below 11 picograms per ml, okay, it's not that far from 10, like whatever, it's very significant difference. That was definitely bone loss. And if it's at or above 11 picograms per ml, that just stops the bone loss and 50% less hot flashes. Okay. And then above 20 picograms per ml, the bones started to form. And then there was a threshold between 60 and 80 picograms per ml that Dr. Doug pointed out. Dr. John said he found research showing 100 picograms per ml. And in the end, like, we don't want to say, oh, let's shoot for 20, like the very, very low. I would shoot for closer, somewhere between the 60 and the 100 picograms per ml if you can tolerate it. Because some women at 100 can't tolerate it, or they don't have it in estradiol in balance with progesterone. Like, go to a hormone specialist or a menopause specialist who understands where not only what your estradiol levels should be, but they want you to feel good. And like, if you're not feeling good, or you're gaining weight, or you're not getting the benefits, or you're feeling nothing, something's off. And it's not just, oh, let's give you more. It could be so many other things. I have episodes on why these things go wrong. But both of these doctors that I've interviewed, they do look at other markers other than estradiol. They look at FSH, which is follicle stimulating hormone. They look at the CTX. They take a holistic view of their patients, of the people they're looking at. It's not just a number. It's really the whole picture. And then Dr. Mary Claire Haver pulled out another study that Zhu and colleagues published in 2021. And they shared like an inverted U-shaped relationship between estradiol and bone mineral density. So they found out that the density increases with estradiol up to approximately 70 picograms per ml, after which there was no additional benefit and potentially even harm to the bones, right? We're not talking about harm in general. So she likes her patients to be somewhere between 25 and 70 picograms per ml. Like, everyone's a little different. Okay. So you decide, you do you, and you have this conversation. So just to clarify this, below 11, you're in trouble. Between 11 and 20, you're losing ground. Above 20, bone formation and resorption come into balance. Above 70, evidently you're not getting anything else special with your bones. So the question is, do you know your estradiol levels? Have you tested them? Does your doctor even offer to check? Because you don't feel your bones getting brittle. And osteoporosis is silent until it is silent no more. And we're mostly worried about fractures of the hip and the spine. And it could be a really strong wake-up call. If that happens, then 50% of us who have that don't recover from them. That means your quality of life goes down the tubes. And 1 in 2 women over the age of 50 will have an osteoporotic fracture. That's a big number, and we want to avoid it. That's why you're here. That's why you're listening to this, right? And the only way to know this is if you check your estradiol levels and make sure that your skeleton is protected. And another really important nuance that we need to consider is that HRT, or hormone replacement therapy, is best when it's started close to menopause and not decades later. Now, what does that mean? Well, HRT, we talk about prevention and treatments, okay? So HRT is primarily used, like if you go to a doctor, just a normal doctor, they just say, well, it's hot flashes and prevention of bone loss. Yeah, it's actually one of the things that most doctors agree on. But it's the prevention of bone loss during menopause, but it's not maybe enough of a treatment as a sole treatment for advanced osteoporosis, or if you've got a very high fracture risk. And anyways, hormones are not, we still need to do all the other things in terms of exercise and nutrition and sleep and stress. And this is why we're covering all these things on this bone series. So for many women in early menopause, HRT can really slow or prevent that really fast decline that happens during this period. And that's really important. When you're decades out, like, damage is done. Now, it doesn't mean that we can't go on HRT, that we can't help, but it's prevention is always better than cure, right? So what are the types of hormone therapy that are relevant to bone? So it's estrogen, it's estradiol. So we have many different types of estrogen. We have many different types of HRT. I'll have other episodes on this, and I can, if you need it, let me know, or just kind of scroll through the podcast. You're going to find loads of podcast episodes on explaining hormone therapy. Now, generally with the studies, they're very often using oral or the synthetic estrogen versus bioidentical, which is if you look at the bioidentical, which is, I don't like calling it natural, but because all of these are fabricated in a lab, but it's identical to the kinds that our body makes, which I generally prefer. I don't want to poo-poo oral because, I mean, there are some risks, but some of us actually have to take it. Like and maybe a lot of other benefits. Now, that's a whole other can of worms that we can open up. But generally speaking, we're talking about estradiol, oral or synthetic, bioidentical. Then there's transdermal, which means goes through the skin, whether it's a pill, a patch, a cream, a gel, spray. These are many different types. There's pellets. And then those are the kinds of very generally speaking, of hormones that we can take, that we normally take. Then there's progesterone. Progesterone protects your uterus. So usually if you still have a uterus, you need to take the progesterone one way or another. But in terms of bone health, it has a secondary role. It's supporting estrogen, and it helps it by stimulating that osteoblast activity, building up the bones. And then we have testosterone, and that's another supportive role. And it helps with the muscles, which helps pull the bone, and when that pulls the bone, then it sends a little signal to the cells to actually start building. So if you want to learn more about testosterone and bone, I would certainly go follow Dr. Kelly Casperson. We did a great podcast interview with her, but testosterone generally helps maintain bone mineral density and keeps that balance going. I'm sure she's probably pulled out way loads of more great studies done on how testosterone helps the bone. So go follow her for more of that. So generally speaking, yeah, bone responds mostly to the estrogen levels. And when that goes, that's why women get more osteoporosis than men. So what does HRT not replace? This is a really important part. It doesn't replace strength training. It doesn't replace the impact and the balance that we need to work on. It doesn't replace getting enough protein and adequate and good quality protein. It doesn't replace the calcium, the minerals, the vitamin Ds, everything that we need to take. And it doesn't replace getting good sleep and managing our stress. So those are really important pieces to bone. And hormone therapy is just one of the tools in our toolkit to help us, but it's a pretty big lever. That's why I'm covering it in this bone series. So without all those other inputs, HRT can't completely protect your bones. So think of HRT, it's just like a supportive, it helps restore the environment, the terrain, so that all the other things can work really well. Who can benefit most from HRT or hormone replacement therapy? Women who are in perimenopause. Certainly, if that's when most of the bone loss is happening, then we definitely want to look at it and try to get it in, or at least make sure we have good, robust levels in perimenopause and early menopause. That's when we really lose most of it. Anyone who's got osteopenia, I've done a DEXA scan. If you have a DEXA scan, this is a bone scan. I have listened to episode 1 to understand what that is. I would highly recommend going and getting a REM scan, REMS, because you may have osteopenia, but you may have strong bones. I don't know, maybe not, but that certainly gives you much more insight as well. And then if you have a family history of osteoporosis or a family member who's fractured bones, you may be more at risk. If you're low body weight or have a small frame, also more at risk. And then if you've had surgical menopause, honestly, definitely need to look into this. So when you are looking at hormone therapy, especially for bones, you've got to have that conversation with your doctor. It's so super important because it has to be personalized. And that doctor will hopefully allay any fears or any misconceptions, because we have the Women's Health Initiative study that scared everybody off hormones, and that's been reassessed and now been proven that hormones are actually quite good for us. And again, everyone has to have that risk versus benefit conversation with their doctor of taking hormones and what's the risk versus the benefit if you don't take it. So have both of those conversations. And now I just want to close off and remind you that bones are a living tissue. It's a whole system here. We got to understand how to take scans, how to interpret them. We got to look at load and movement and how that supports the skeleton and eat the right foods and make sure those building blocks are there. And then hormones that help regulate this remodeling process. So HRT really honestly is such a powerful tool for protecting our bones during perimenopause and menopause, but it's just part of a really comprehensive strategy of many other things as well. So in the next episode, this is the final episode that's coming up, we're going to talk about the last pillar that many women kind of underestimate, but it's really powerful for your bones, and that's sleep and stress. Right? When we sleep, things repair and rejuvenate, right? That's why we want to get as much deep sleep as we possibly can. But we'll talk all about that next time. So a reminder to download that mini bone guide. It's so useful. It's in the show notes. And if you want to support implementing these strategies and you need a plan, a program, or someone to hold you accountable, then join the Biohacking Menopause membership group where we dive deeper into these topics. And lastly, I just want to thank you for joining me all the way to the end. I really value your time, and I'm just so grateful that you're here. I wouldn't be here if it weren't for you. And if you enjoyed this episode, please share it with a friend or a family member who is also unclear about how hormones affect their bones. So with that, have a good day, good night, good morning, wherever you're at, and I will see you next time.